Welcome to Learn Classic Education. Today we are going to study about nursing management on diarrhea. Okay, so diarrhea is a very common problem. It occurs almost in everybody. So today we're gonna have a final revision on diarrhea, starting with nursing role in diarrhea. So it is you all know what does diarrhea means. Diarrhea means frequent loose or watery stools. Diarrhea means frequent loose or watery stools. Now coming to the definitions of diarrhea. So diarrhea is the passage of 3 or more loose or watery stool in 24 hours, and so it is the passage of 3 or more loose or watery stools in 24 hours. So it may be acute, persistent or chronic. So it can be three types, that is acute, persistent or chronic, and can lead to dehydration if not managed properly. Okay. So what is diarrhea? Diarrhea is the passage of 3 or more 3 or more loose or watery stools in 24 hours. It may be acute, persistent or chronic, and can lead to dehydration if not managed properly. Now coming to the causes of diarrhea, it is very important. What are the causes of diarrhea? Now the most common causes of diarrhea is bacterial infection, viral infection. Now bacterial infection example is like E. coli and Salmonella, and viral infection is rotavirus or norovirus. Then coming to the parasitic infection, food infection, contaminated water and food. Contaminated water and food, we all know contaminated water and food, certain medications, that is antibiotics, laxatives or diuretics, then food allergies and intolerance, and then gastrointestinal disorders. So these are the common causes of diarrhea. So what are the common causes? Bacterial infection, example like E. coli and Salmonella. Viral infection, rotavirus, norovirus. Parasitic infection, food poisoning. Food poisoning is the very common cause. Then contaminated food and water, that is the junk foods we all eat outside, certain medications, food allergies and intolerance, and gastrointestinal disorders. Now coming to the risk factors, the factors increasing the risk for the diarrhea. What are the common risk factors? That is poor sanitization and hygiene. Poor sanitization and hygiene, unsafe drinking water, malnutrition, weakened immune system, young children and elderly age. Then comes the travel to endemic areas and inadequate hand washing practices. So what are the common risk factors? Poor sanitizations and hygiene, unsafe drinking water, then weakened immune system, young children and elderly age, then travel to endemic areas and inadequate hand washing practices. So these are the common risk factors for diarrhea. Okay. Endemic, epidemic, all those areas where there is contaminated food and water is there. So in that area, if you eat any food or contaminated drinking water, you could have diarrhea. Now coming to the signs and symptoms, clinical manifestations. The first is frequent loose or watery stool. We all know there will be frequent loose or watery stool. Then abdominal cramps and pain, nausea and vomiting, fever, urgency to defecate. You will have continuous loose motion, that is urgency to defecate. Then coming to the weakness and fatigue, dehydration, weight loss. Weight loss in severe cases, like when you are continuously passing loose stools and you are continuously suffering from dehydrations, then you will have weight loss. Now coming to the pathophysiology of the diarrhea, the main mechanism how diarrhea occurs, that is, we will read it step by step. Pathogens or irritant enter the gastrointestinal tract. So at first, the pathogens or the irritant enters into the gastrointestinal tract. Then coming to the increased secretions of intestinal mucosa becomes inflamed or damaged. Then there is increased secretion of water and electrolytes into the intestine, decreased absorption of fluids, rapid intestinal motility occurs, and excess fluid is passed or loose or fluid is passed as loose or watery stools. So the mechanism is in step by step is pathogen or irritants enters the gastrointestinal tract. Then the intestinal mucosa becomes inflamed or damaged because the pathogens have entered. Then there is increased secretions of water and electrolytes into the intestine and decreased absorption of fluids. So it causes decreased absorption of fluids, and then there is a rapid intestinal motility occurs. Inside there is a rapid intestinal motility occurs because there is decreased absorption of fluids, and that causing the excess fluid is passed as loose or watery stools. So this is the mechanism of diarrhea. Now diagnosis, how you will diagnose the diarrhea: health history and physical examination, stool examinations and culture. Stool culture is sent. First is health history and physical examination, then stool examination and culture. CBC is done, complete blood count. Electrolyte assessment is done, dehydration assessment is done. Colonoscopy is done in extreme cases for chronic cases. Then test for parasites and infections. Now coming to the main important part, that is the nursing management. In nursing management, the nursing intervention is we have to access the frequency and the characteristics of the stools in the stool culture. Frequency, how many times the patient is passing the loose stools. Then monitor the vital signs. It is very important to monitor the BP, pulse rate, respiratory rate. Then maintain the fluid and electrolyte balance. Very important in case of diarrhea, otherwise the person will suffer from severe dehydration. Then administer oral rehydration solution. We all know that. Record intake and output. Provide skin care to prevent irritation. Administer prescribed medications. Educate patient on hygiene practices. Very important to educate the patient on hygiene practices. Now coming to the preventive measures. So what are the preventive measures? That is, proper hand hygiene is very important. Safe drinking water, proper food preparations and storage, good sanitizations practices, then vaccinations, rotavirus vaccines. It is important to remember rotavirus vaccine. Avoid contaminated food and water. That is, food poisoning is the main reason for diarrhea. Promote exclusive breastfeeding in infants. In infant, exclusive breastfeeding is very important. Now coming to the complications and conclusions. Okay, if there is severe dehydration, then early diagnosis and adequate hydration is very important. In case of electrolyte imbalance, proper nursing care and prevention is very important. In case of malnutrition, measures are essential to reduce. And in case of shock, morbidity and complications need to be checked. Then in case of kidney failure or severe cases in diarrhea, it is associated with diarrhea. Okay. Thank you. With this, we have come to the end of nursing management for diarrhea.